Hi, I'm Jeff Raymond, medical writer for the Oklahoman, and I'm here with Jeff Dismukes, Director of Public Information for the State Department of Mental Health and Substance Abuse Services. We'll be talking about this week's news from the world of mental health and substance abuse, and I'd like to start with a report here from the federal equivalent of your agency,
right.
dealing
Substance
with
Abuse Mental Health Services Administration.
How do you say that? SAMHSA?
It's SAMHSA, Substance Abuse Mental Health Services Administration.
Okay, that's a bit of a mouthful.
Yeah, we have long titles in this business.
This report from SAMHSA, the high points, at least for Oklahoma, I think, dealt with prescription drug abuse and actually some encouraging news about minors and alcohol consumption. So I know you've looked at the report and
taking a look at it.
Would appreciate your interpretation on what you think about it.
What we think about the report. I think with any report, anytime we're looking at any of this type of information that's coming out, you want to weigh it against all the information that's out there, and you use it as a guide to shape what you're going to be looking at in the future. Certainly, the issues of substance abuse have long been a problem in Oklahoma, and they continue to be. Some of the encouraging news on there, I hope that's a reflection of the programs that we've been putting in place, especially in the last couple of years. We've really made an effort to address underage drinking in the state. State leaders have embraced these issues, and we need to continue with that kind of work. Now, I would say that the issue of abuse of prescription medications, we've seen that as something that's becoming more important. It's probably an area that we need to give some more attention to.
Would that area be one that has received adequate attention either from the public or from governmental bodies in the past?
Well, I think it's probably receiving more attention now. It's one of those issues that it almost sneaks up on you in a way. It's something that we haven't addressed or weren't necessarily addressing that much several years ago, but has really come to the forefront lately as we see an increase in the misuse of the prescription medications, and Oklahoma was high as far as compared to other states in the nation as far as misuse of these medications.
Well, in this report it says that in the latest, or according to the latest data available from 2005 and 2006, 6.7% of Oklahomans 12 years and older used prescription painkillers for non-medical reasons, and that was almost almost double the rate from the three lowest states. And I'm just kind of curious what some of those drugs are, and if the drugs that people have abused or are abusing have changed.
Well, I think you always hear about the Oxycontins and the different types of pain medications that are out there. There are a variety of medications that, when they're used appropriately, are life-saving drugs, and they really increase the quality of life for individuals, but they can become very dangerous when they're misused, and especially when they fall into the wrong hands. And I think we need to be vigilant about that and start thinking about the different types of things that we can do to make those medications less available to those that shouldn't be getting a hold of it. And by that I mean, and as a parent myself, we need to look around the medicine cabinets at home, make sure that we have things put away. And of course, we talk about that a lot with alcohol. With alcohol issues, that's something that needs to be understood. We need to be a little more vigilant. There's some things that we can do to make sure that young people don't utilize these things in the wrong way and don't suffer the consequences.
Would you say the parents take the same steps to keep their kids out of the medicine cabinet the way they would out of the, out of the wet bar?
I think for a lot of parents it's something that we just haven't thought about, and so there is a real need for increased education in that area.
The report also dealt with a slight decrease from 2005 to 2006 in underage drinking, and some of the people I talked to attributed that to programs that are aimed at reducing youth drinking, and saw some encouraging signs. Whatever you'd like to say about that.
Well, again, I hope that is a reflection on the things that we've been doing as a state. Now, I have to say, anytime you look at these types of studies, there's so many different studies out there, and numbers can vary by studies. This is a household survey, and was a national household survey. I don't know how many people they actually talked to in Oklahoma. It could have been 10, it could have been 100, I'm not sure. But Again, anytime that you have these studies, anytime that these types of numbers out there, I think you use that to gauge as to whether or not what you're doing is working, and should you continue things in those areas. Now, we do a lot of other studies. We have some reports that go a little more in depth in these areas, and we know that in Oklahoma, by their senior year in high school, overwhelming majority of teenagers have already experimented with alcohol. We know that the binge drinking rates in our state are high.
That remains a problem for Oklahoma.
Remains a real problem for Oklahoma. So by no means should anybody interpret that this is a problem that has gone away, that we shouldn't continue to address. I think really what this helps us to understand is that we need to continue the types of efforts that we have been doing over the last few years and really address this problem. This is a problem that's been huge for Oklahoma for a number of years, and I'm happy that we're really finally starting to give it some additional attention and see what we can do about preventing the problems that we have with underage drinking now, and in turn preventing the problems that many Oklahoma adults have later on with addiction. So
is underage drinking something that can be prevented with the right amount of work or the right approach, or is it a cultural issue that really takes a lot more to eradicate?
Combination of things. We have to begin educating people early. We have to educate not only the youth, but we have to educate parents, and we have to break this cycle that we have had in Oklahoma. This almost rite of passage that people seem to think that young people need to go to. The bottom line is that we as adults and need to look back at our youth and our lives and draw upon our experiences to keep our children safe. And this is an issue that really deserves more attention.
What have you seen in terms of programs that have worked, in terms of some promising areas, something that's been effective?
There are a lot of programs that work within the schools, working individually to do training with youth and to get youth involved as leaders. There's a program over in Shawnee, our Area Prevention Resource Center.
Shawnee Youth Coalition, I believe?
Yeah, the Shawnee Youth Coalition, and they've done some wonderful things. They've even worked with their local legislators to address legislation this session that looks at providing education to individuals about alcohol abuse, particularly as it involves the fetal alcohol spectrum disorder, and providing information to expecting parents so that they understand exactly what alcohol does during pregnancy, and also have an understanding of how to address these issues later as parents. Those types of programs have been fantastic. Also, we have the social host laws across the state. Those have been tremendous in getting, not only just educating the public, but helping to stop underage drinking in communities, and I think these types of programs and continued education, continued outreach is what we need to do.
Do you know how many social host ordinances there are in the state, or whether or not other cities are considering adopting them?
Unfortunately, I don't know off the top of my head how many that are already out there.
I know there's several in the metro area.
Yeah, there's several in the metro area, and there are several other communities. Every day I hear about it or talking about this and really looking at it, because the bottom line is these types of programs work, and other communities are seeing the benefits of it and understanding that this is what they need to move forward with.
So when you're talking about reducing alcohol use among adolescents, among minors, is it a matter of keeping them from accessing alcohol, or is it also a matter of teaching them why they shouldn't drink, or
Both.
Certainly why they shouldn't binge drink?
Both. One, we need to realize that it's illegal for anybody under 21 to be drinking in the state of Oklahoma. We need to keep alcohol out of the hands of these youth. At the same time, we need to be educating about the realities of alcohol, and so that they understand the dangers, and so that they can make responsible decisions when they're adults.
And those realities are that for a number of people, alcohol isn't simply a rite of passage, but something that will continue to be problematic for the rest of their lives.
That's right. People need to understand the realities.
On a mental health note, actually, I guess before talking about strictly mental health issues, I'm curious the extent to which substance abuse and mental health are linked together. I don't know the stats off the top of my head, but if you could address the confluence of those.
I think especially in recent years we've come to understand the relationship there. A lot of times people with undiagnosed mental health issues turn to alcohol as a way to self-medicate, and people with addiction issues sometimes have underlying mental health needs that contribute to their addiction. So there's definitely a relationship between the two. And one of the things that we have been doing as a state is trying to break down some of the barriers to people being able to receive treatment for dual diagnosis issues. In the past, it has been that somebody with a mental illness would have to go to a certain type of facility. Somebody with a substance abuse issue would have to go to another facility, and you didn't necessarily do the treatment simultaneously.
Right.
That's something that the department has invested a lot of time into in the last few years, and moving forward with making it possible for people to access the treatment that they need to recover from their illness.
Speaking of this, the House of Representatives this week passed legislation that would place, called parity legislation, that would place mental health services on par with other health insurance provided benefits. And I'm curious what your take is on that and of the need for that.
It's been a long time coming. This is it's an important issue for us. You know, people with a mental illness, if they had health insurance, oftentimes their health insurance wouldn't cover them for their illness, or would only provide limited coverage.
It's typically several visits, 3 visits or so, or something like that.
A few visits a year, you know, and I can't remember off the top of my head how many, but basically, you know, 12, 14, somewhere in there visits over on an annual basis.
Okay.
And every plan's a little bit different on what they offer, but typically it is limited, and that's not the way these illnesses work, and they're not treated the same as any other illness. The same for addiction. You know, some plans cover it, some plans don't cover it, or only partially cover it. You know, these illnesses, and part of that runs back to stigma, in the fact that people have not looked at these illnesses as illnesses. They've looked at them as some sort of personal flaw or something that's not treatable, and it's just not the case. The illnesses that we're talking about are often more treatable than other diseases such as heart disease, cancer, diabetes. They are significant public health problems, not just in this state, but on a national basis. And they're issues that need to be addressed. We know that if people can receive the type of treatment they need, and effective treatment early, that it will speed the process of recovery. It's going to save money. It's going to save lives. It's the right thing. So I mean, having this happen now, as we finally put this all on a level playing field, is going to be have a tremendous impact on individuals in need.
Well, I know proponents of parity legislation have said that although there could be a cost up front, or although there will be a cost up front, that in the long run it will actually save money. Is that
right.
something that?
And studies have proven it. This is something that's been looked at closely, and it's been studied. And in fact, where insurance companies have or where coverage has been provided, and they have seen, you're right, a cost reduction over the long term. You know, a lot of people don't realize that these illnesses contribute to other illnesses. I mean, there's a direct relationship between addiction and substance abuse issues and heart disease and high blood pressure. There's some links to other chronic diseases there. The same with mental illness. These are things that if we can treat early, make a difference in overall health.
Well, I've been talking with Jeff Dismukes of the State Department of Mental Health and Substance Abuse Services. And, thank you very much, Jeff.
Thank you.
I appreciate it.
Appreciate it.